High blood pressure, which is also known as hypertension, is a serious health condition that causes complications throughout the body, from heart attacks and headaches to eye and kidney damage. Let's review what blood pressure is and then how diet is related. So blood pressure is actually the pressure that blood exerts on an artery wall. I'm going to draw here a schematic of an artery, and we think about blood flowing through this. When the heart is beating, it will actually have a higher amount of pressure going up against those artery walls. And then when that heart is at rest, there's a smaller amount of pressure. So when you go and get your blood pressure taken with that cuff around your arm, they're measuring that difference between when that heart is beating, and they'll call that pressure the systolic pressure, and then when that heart is at rest, and they call that the diastolic. And the unit being used here for that measurement is millimeters of mercury. Now, when they report it, they'll give the systolic over the diastolic, so you'll get a blood pressure of 120/80. If we are above that, we have hypertension, and they have stages of that. Stage 1 is when you have a blood pressure of 130/190 if it's systolic and 80 to up to 90 for the diastolic. This stage 1 is considered the level of which when lifestyle can still make a difference and get your blood pressure back down to normal levels. It still has negative consequences, so it's one that we want to reduce it, but it's not so severe that they're going to force medication on that individual. But once you have a blood pressure that has a systolic above 140 or above 90 for the diastolic, you really need to take medication to get it back down. If we look at the incidence, how much do we have of this in the U.S. population? Here's data reported by the National Health and Nutrition Examination Survey, and they look at the overall incidence of hypertension, and it's about 30% of adults in the United States, so about 1 in 3 individuals have pre or hypertension, stage 1 and stage 2 and beyond. If we look at the difference between the sexes, there's not a huge difference between them, but this data is a little bit misleading because it's for everyone, and in reality, men tend to get it at an earlier age, but we women catch up when we get into our 50s and 60s. And looking at age, we can see the difference in what is happening here. For all you young students out there, less than 10% of people before the age of 40 have hypertension. But by the time you're over 60, 65% or 2 out of 3 people have hypertension. When we take a look at race, what you can see there is that the group of individuals who have the highest incidence are going to be those of non-Hispanic Black heritage. And not only do they have a higher percent overall, but they tend to get it earlier in life and to have more severe consequences. If that's your heritage, you're going to get your blood pressure checked and you're going to maintain medical care around that. So these are incidents, and we're looking at risk factors associated with development, but these are risk factors we can't change. But lifestyle can make a difference, and part of that is diet. So let's take a look at what we can do to lower our risk. Lifestyle changes that can help reduce blood pressure include the usual suspects of maintaining a healthy weight and being physically active. Both of those have been shown to be able to reduce blood pressure by about 3 to 7 millimeters each. And then, of course, having a healthy diet. Research linking diet with blood pressure have looked at many different variables, some of them foods, some of them nutrients. Foods have included coffee and tea, soybeans, fish oil, chocolate, alcohol, and then all kinds of different nutrients. Sometimes it can actually seem overwhelming. But sodium is the one that probably has had the most research and probably is the most impactful. So we're going to review that. Then we're going to take a look at the dietary recommendations associated with blood pressure, and they actually have a specific dietary recommendation called the Dietary Approach to Stop Hypertension, which tries to incorporate as much of that research as possible. First, we need to understand how sodium is regulated. It is not regulated at the GI tract. If you consume more sodium or salt, you're going to absorb it. Rather, sodium is going to be regulated at the kidneys. And if we are healthy individuals, we will generally be at equilibrium. That means if we consume more salt or sodium, we're going to excrete more sodium or salt, and vice versa. We consume less, we excrete less. But there are some individuals that we call salt or sodium sensitive. For those individuals, their kidneys are less efficient at removing that excess sodium, and therefore they may experience hypertension when they have a higher sodium intake. And this graph really demonstrates that. So let's take a look at what this graph is showing. It is looking at the changes in systolic blood pressure here at the top and the diastolic blood pressure on the bottom part of it. And coming across the right of this, we're looking at changes in urinary sodium, which is the first line there, variables, and also the change in the grams of salt in the day. Now, what this represents is the amount removed from the diet. So it looks odd because it's going up in numbers where the amount that's coming out in the sodium, but what that is, again, the amount of salt that they removed in the diet. To understand that the average intake of salt was about 9 to 12 grams a day. So let's compare that to sodium. So 9 to 12 grams of salt equals about 3,500 to 5,000 milligrams of sodium. And just to recall, the dietary guidelines is recommending that we keep that to less than 2,300 milligrams. So this group of individual was definitely above the dietary guidelines. As they were taking out salt, you can see what was happening to their blood pressure. But we have two groups here. They were looking at healthy individuals and individuals who have high blood pressure. And for both the systolic and diastolic, we can see that for those individuals who had hypertension, that their blood pressure was being impacted more. When they took out more sodium, their blood pressure was dropping more. For those individuals who were healthy, though, it did not have a big impact, a slight impact, but not dramatic. So again, those individuals, if they had more sodium in their diet, they actually just excreted more. It was those individuals who were sodium or salt sensitive that had the bigger impact. Now, it's estimated that between 30 and 40% of the general population are salt or sodium sensitive. It's not easy, though, to identify an individual, specific individual that is likely to have that. We do know that certain population groups will have a higher incidence. In fact, individuals who are hypertensive, probably 50 to 70% of them will be salt sensitive. Other population groups include individuals who are obese, individuals who have diabetes, and individuals with Black or African American heritage. So now we understand for those individuals who are salt or sodium sensitive, if you reduce the salt and sodium in your diet, you will have a lower blood pressure. Let's take a look at the DASH diet. Remember, DASH stands for the Dietary Approach for Stopping Hypertension. And it doesn't just look at sodium. It also takes a look at those other nutrients, things like potassium, calcium, magnesium, protein, and fiber. All of the ones we need to increase in our diet, not just the reduction in sodium. It's very similar to my plate, but it's a little bit richer in those grains. It's going to be low fats. It's going to also include those nuts and seeds that research has shown to be helpful. So lifestyle change can help reduce one's risk for hypertension, especially for those individuals in that pre-hypertension values. So that if we're just modestly above our blood pressure levels, we can get it back down to normal and help reduce our risk for chronic disease.